Hi, this is Dr. Brian McDonough. Welcome to an encore presentation of AMGA's Executive Pulse. If you want to see other AMGA Executive Pulse episodes, just go to amga.org where you can see them on a regular basis. Hi, it's Dr. Brian McDonough, and welcome to Executive Pulse. I have a very special guest today, Rachel Jones, who was the CEO of a company called Syntax, which was acquired by Lightbeam Health. It's all about value-based care, which I know she's passionate about. First of all, Rachel, welcome to the program.
Thank you so much, Brian. I am glad to be here and to talk about my favorite topic, value-based care. I like to say I'm a self-described value-based care evangelist. So this is absolutely something I love talking about. I think your question, which is a very loaded question, but a good one, which is sort of what is value-based care and why you should care about it. The best way I can answer that is perhaps tell you a bit about my career and what I've done in the last 25 plus years. Most of my time has been on the health plan side, leading network analytics, contracting teams, health economics teams. But I spent a long time at Anthem, now Elevance, leading their payment innovation analytics team. What that meant is that my team and I had responsibility for supporting the end-to-end value-based care programs that Anthem, now Elevance, had set up. And that's really where I got my first taste of understanding the purpose of value-based care and the power of value-based care to transform quality and outcomes. The simplest way to understand value-based care is to think about how do we incentivize physicians and members / patients to make decisions about their care that consider the total cost of care, right? Not just episodic or visit-based, acute-based procedures. So to my friends and family who are outside the healthcare arena, I talk about it like this. Imagine going to get an oil change. And you get your oil change, you pay your $30 and they change your oil and you drive off and your tire falls off, or your engine all of a sudden blows up, or something goes wrong in your car. And you're like, wait a minute, I just took my car in for an oil change. Why wouldn't they have caught this problem while I was there, right? And you felt like you didn't get a lot of value for that visit in getting your oil changed. Take that same analogy and apply it to healthcare. When most people go to the doctor, they're going for maybe a runny nose or a cold or a sore back or maybe a broken bone, right? Value-based care says instead of just addressing the problem, which you want to address the problem and get that person well, but value-based care says let's go beyond that. Let's also reward that physician if they take the time to look at that person's whole health and ask about what's going on in your mental health. Are you eating right? Let's check your blood pressure. Let's check your cholesterol. Let's take the opportunity to consider the whole health of that person.
I'm here with Rachel Jones, and I'm curious what's fundamentally changing in 2026 that we really maybe haven't seen in the past, or we should be looking ahead and anticipating.
Yeah, well, one thing for sure, the only constant in healthcare is change, right? So as value-based care continues to evolve, we continue to see advancing models, more complex models, as we learn more about what levers impact total cost and quality. Certainly, we see a lot of table stakes now being you're in the game, right? So it used to be 10 years ago, maybe 5 years ago, the question was, are you involved in any kind of value-based care arrangements? That question is now a foregone conclusion. Most organizations have some sort of skin in the game when it comes to value-based care, whether it be quality only or actually shared savings and even downside risk. And we see a lot more advancing downside risk opportunities for provider organizations. So what does that mean? That means the question is shifting from are you in VBC to how are you actually performing in VBC? And we certainly know that with tighter margins, a lot more uncertainty, especially coming down from the federal government, as CMS continues to introduce more complex models, we have less room for error. And executives really have to sort of not underestimate how financially complex these arrangements are, and probably don't really appreciate how little visibility they actually have into their performance.
Many organizations are struggling to achieve predictable performance. Why are some struggling? Why are others not? And is there a secret sauce, so to speak?
Yeah, maybe secret sauce is an oversimplified way to do it, but I think there's a lot of folks who assume that if you're just in the game, you'll perform. And unfortunately, that's not how it works. Clarity is what drives performance, financial clarity, operational clarity, clinical clarity into what you're doing. Those are the things that really separate folks who are doing well from folks who are struggling, right? So the folks that we see, that we work with at Syntax and Lightbeam that we see do well, they take the time to have that operational discipline plus financial clarity and really align and connect the dots between financial insights and clinical execution. So what does that mean? That means for successful organizations, they're treating their contracts like financial products, right? Really thinking end to end, not just the contract agreement, but how does this actually flow in an operational setting? How do I change my workflow all the way from the front desk and intake all the way to the back office and billing, right? All of that process is thought about from a value-based care contracting lens. They're certainly modeling their contracts before they sign them and understanding what they're signing up for. And they're not just waiting until the end of a measurement period, for value-based care, that means the time at which we're actually looking at the cost and quality for a population, right? They're not waiting until the end to do that retrospectively. They're being proactive and monitoring their performance all throughout their contracting period, really prioritizing their clinical interventions, figuring out which care gaps to focus on, which care management strategies to deploy for high cost or high impact patients. And they're leveraging data to really guide that conversation, not to just guess. On the flip side, organizations who are struggling, still using spreadsheets, still using back of the envelope math, still sort of hoping for the best, but not really treating value-based care as a strategic asset in their organization, and really haven't connected those clinical and financial dots. And so I think for us, what we see is that the winners in this space aren't guessing. They're modeling, they're monitoring, they're adjusting real time. And the biggest difference that we see is whether organizations can connect that financial insight to the clinical execution.
Contracting is where systems and inefficiencies occur and really things start to break down. Yeah. What are some of the issues with contracting, and what's your approach to maybe doing it better or being at least a bit more successful?
Yeah, I love this because this is one of those maybe boring topics that get overlooked in the world of value-based care. Folks, don't really realize that everything starts and ends with that payment agreement, that contract, as you mentioned before. And I think that it's unfortunate that we've made so much of the value-based care conversation around population health and risk and quality. All those things are really important, but they're housed in a framework that's typically a long document with lots of paragraphs and lots of language that the average provider maybe is not taking the time to read, and overlooking the financial impacts of what's in that contract. So where we see the inefficiencies on our side at Syntax is where you're negotiating a contract and you're using back of the envelope math, or you're saying you're taking the document and not sort of looking at it through fresh eyes. And so we at Syntax, we are a platform that focuses on actuarial science to look at projections for performance. That's a mouthful. So that when we're modeling those contracts, we're taking into account historical performance, what's happening right now, boots on the ground, what's likely to happen in the environment, that specific local environment, because healthcare is very local, as you know, right? So we're looking at all these factors together and applying that sort of actuarial rigor to give our clients the best insight into what they can likely expect under that contract. And then allowing them to play and have a sandbox environment to say, well, I don't really like that outcome. If I change this lever, what happens to that outcome, right? So that process of alignment is the other big inefficiency I see. The payer will come into a conversation with what they think is a golden contract, and the provider will, if they don't have a tool like ours, will sometimes struggle to understand how they fit in that. What we help our clients do is align expectations. What do you mean by attribution? Who's in, who's out? How are you going to actually apply the dollars and flow down to what I get credit for and what's carved out, right? We call that order of operations. What kind of benchmarks are you applying? What's the basis of those benchmarks? How can I get transparency into how am I going to be compared as a provider against the whole group, against the market average? What does all that mean? And I think one of the things that we really focus on at Syntax is let's make it tangible. Let's make it sure that you are understanding what you're signing up for before you sign up for multi-millions of dollars at risk. Let's make sure we get the data and the picture as clear as possible, and we understand the math, right? The math matters. And if you don't understand the math, it's almost impossible to align a clinical strategy.
You said so many important things here. And one of the things that I get as a provider is that transparency is key because it also helps the patient. I mean,
That's
we're
right.
talking financial, but I mean, clinically, it can make a big difference.
Absolutely. And I think that's where we get excited because, of course, we're math nerds and we're numbers nerds. When we see when providers understand their contracts and they now can take that into a clinical strategy and say, hey, we now know for this population, here is how we're going to be able to get incentivized to engage that population. Ultimately, the patient gets better care. And so that makes us excited for sure.
So with this information, we obviously have a lot of executives who see and listen to this podcast. How can they use this information and the work you're doing with Syntax and Lightbeam to help their organization to make things work better? As they're hearing it, it sounds great. What can they do?
Yeah. Well, I think the first thing, as what do they say, knowing is half the battle, right? The first thing is just acknowledging that this is a discipline and a skill that you need to invest in. Financial and clinical systems that allow you to understand your contract dynamics and your clinical execution are critical core infrastructure for any organization that's looking to do value-based care in a meaningful way. To really appreciate the fact that alignment is not a buzzword, it's not theory, it's fundamental. It shows up in every part of your organization. And so that's why you want to be able to have a platform that allows you to see the same data, understand the same assumptions, and agree on how you're going to be measuring performance, whether that be the right benchmarks, the right baseline assumptions, the right trend assumptions. Once you have that alignment, you see trust increase, you see disputes decrease, and overall you see outcomes improve. So I think the goal for us is really to say, let's start having a conversation around collaboration. Let's start working from the same source of truth. And, for us being a part of Lightbeam now, it's really exciting because we don't have to just stop at the financial insights. We can now support our clients all the way through from insight to action, right? From the contract to care to say, here is how you operationalize this contract that you just signed from a clinical and population health perspective, whether that be prioritizing care gaps, automating patient engagement, looking at risk optimization. This is what turns the analytics into true outcomes.
I know your time is very limited, but I do want to ask you, what about the next 3 years? Like, what do you see changing? What's going to happen? Because obviously you have your finger on the pulse, so to speak, about what's happening. What do you see?
Yeah, well, I can guarantee you more change. that is for sure. That's one thing I can feel pretty confident about. I do think that one of the things I've noticed in my career is that no matter who's in Washington, CMS is doubling down on value-based care. Healthcare costs have been a runaway train in this country for a long time, and frankly, will continue with the aging population. We will absolutely see healthcare costs continue to rise. And so one of the ways that CMS and others are trying to counter that is by pushing more accountability at the point of care on providers to say, let's think about ordering tests that are not wasteful. Let's think about preventative care. Let's think about advising our patients and our members on health and wellness, right? And so I think we're going to see a lot more pressure coming from CMS and national payers, because national payers and regional payers tend to follow the largest payer, which is CMS. We'll continue to see that doubling down on accountability, whether that's alignment through Medicare Advantage, like the team model, for example, or through emerging models in Medicaid and other parts of the business. We will continue to see pressure coming there. I think what that means practically for organizations is that we can't just guess. We have to get precise. We have to have the discipline and the infrastructure to deal with things like redetermination, in Medicaid, to deal with things like tighter benchmarks in access and ACO models, to understand how rural health transformation translates into opportunity, but also a big job. If you now have no infrastructure, how can you be successful in rural health when you haven't taken the investment, right? So it's all these things that we're seeing. And I think the one thing that we see in common is that no matter what's changing, the financial complexity will continue to increase and the margin for error will continue to decrease. And so wherever organizations can invest in real-time contract performance visibility, where they can have the ability to look at those different contract models before they sign, where they can connect and break down silos between their clinical, operational, and financial teams, all the better. And I think the organizations that are going to succeed will not react. They will be responsive, they will be strategic, they'll think ahead, and they'll invest in the infrastructure that allows them to really think about how care is delivered and how they can align across all sort of planes of their performance.
Rachel Jones is the CEO of Syntax Health, a division of Lightbeam Health. And I do want to ask you one last question. It's my favorite, but what did I ask you that you wanted to talk about? You really wish we had a moment, because you've covered so much. It's been fascinating.
Yeah, well, thank you so much. This has been a great opportunity. And again, this is my favorite topic to talk about. I think the one thing I will say, and this is fresh off the last few weeks of attending conferences and sort of being out in the field, I think that providers in general, but certainly some providers think about contracting as a one-time thing, right? I do my contract once a year with my large payer or with CMS, and I kind of set it and forget it. And that is such a missed opportunity. These are living, breathing organisms that you can't just negotiate one time and put down and kind of get back to work. The contract is the work. And I would challenge any provider organization, any payer that's working with providers, to sort of pop quiz yourself and say, when's the last time I actually read my contract? And when's the last time I actually paid attention to that, to the numbers I'm getting benched against, right? And if you need help, call us. We're here to help you do that, because I know it can be difficult, but that's really where you're missing out. And we see so many providers leaving millions of dollars on the table for the simple fact of not paying attention to what they've signed up for.
Rachel Jones, thank you so much for joining me on Executive Pulse. It was an honor to have you, and boy, a lot of great information. And for those who enjoyed this, we obviously have more episodes. You can see more information, and we hope you become a fan of Executive Pulse and make it one of your favorite podcasts as well. Thanks again. I really appreciate it, Rachel.
My pleasure. Thank you.